Hello and welcome back. If you haven't been watching, this is a radiologic video series on how to interpret different kind of radiographs, all pertaining to emergency medicine stuff. My name is Dr. Carlo Ojet. I'm an emergency medicine physician who is posting these medical education videos. The first two videos we did were normal anatomy on the chest x-rays, and then we did a clinical case on a patient. So this is the fourth video in the series, and these are actually some abnormal x-rays, which will be very good to compare to the pictures on the normal x-rays so you can see what the pathology is. In this particular x-ray, we're talking about the aorta, and this is a PA, that means posterior anterior, and lateral radiographs of an elderly adult. And the main difference here is going to be that the aortic knob, which we discussed before, this thing right here, is a lot more prominent in this elderly patient. And that has to do with the aorta being enlarged by itself. On the lateral film, you can see the aorta being traced all the way down to here. And in a normal, healthy patient, you don't see that. Remember, you could see the aortic knob over here, and then it just kind of disappears. You can't see the tracing of the aorta like you can on this particular x-ray. And the reason is because on the elder patient, the descending aorta is elongated or uncoiled, and it's also dilated and ectatic. That means the blood doesn't flow as fast. So having more volume of blood, of liquid going through at any given time, when the x-ray rays, when the rays of x-rays just trying to shoot through, the fluid actually stops some of that, so it makes the area more dense. It gives it more density, and that's why you can see it more. So that's why this x-ray is particularly different. You got the enlarged aortic knob, you got an elongated and tortuous ectatic aorta. Now let's look at this other x-ray. This x-ray is clearly abnormal compared to the ones we've seen before. Immediately you can see the major finding is the heart. It's very enlarged. Now remember, we talk about the cardiothoracic ratio. That means that cardiothoracic, so the thoracic and cardiac sizes should be less than 50%. In this case, it's more than 60% potentially. This particular patient is a patient with rheumatic heart disease. That means they have mitral and aortic stenosis from chronic changes from the rheumatic heart disease. And the main things that are being shown here are, one thing that you see right away is a widened angle between the right and left bronchus there. Normally it would be something like this on the normal chest x-ray. So this is a widened angle between the left and right mainstay bronchus. And the carina, which the carina is that where the main bronchus splits into the two bronchus. So this here is called the carina. What else? So the other thing they're showing here is this is the left atrial appendage here, and this actually is still the left atrium behind the heart. You can kind of see it going like this. So that's all the left atrium. So that's real big. And the same thing's being shown on the lateral film here. It's the superior portion of the heart border, and this is also due to left atrial enlargement. So the atrium gets really big because, as we said, this is mitral and aortic stenosis. The heart has to pump the blood because it's a very tightened valve. So eventually those muscles get big, which is not good in the case of the heart. We don't got those muscles being big and thickened because the ability to pump blood out gets compromised in these patients. And our last abnormal x-ray, this is an x-ray that looks just very big, large downwards, very big this way. And this is a patient with a COPD, or chronic obstructive pulmonary disease, or some people call it emphysema. Emphysema is just a general term for scar tissue in the lungs and stuff. And there's many different causes of emphysema, but COPD, chronic obstructive disease, is one of them. This is a 70-year-old patient with cor pulmonale. And the main things we're seeing here is that the diaphragm is flattened. Normally you would have seen something kind of like this. and this is flattened. And also the thoracic height is increased. So normally the aortic knob would be very close to here, so that space between the top of the lung and the aortic knob is increased. It's a greater distance. And on the lateral view, the thoracic anterior posterior diameter is increased. So this is bigger than it should be normally, something like maybe like that, right? So this is increased as well. And that's it for today. So we learned what the aortic knob, how it looks bigger in elderly patients, how the aorta becomes elongated and ectatic or tortuous aorta. We talked about cardiomegaly or enlarged heart size, not only because we can measure the cardiothoracic ratio is more than 50%, that's considered cardiomegaly, but in the second x-ray, which I actually didn't mention in the video, is that although the heart did not look big, because of the thorax gets so much bigger because of air trapping in that COPD patient, the lungs get bigger, the chest wall gets hyperinflated. Even though the heart looks normal, they actually do have cor pulmonale, which results in a big heart. So that patient, even though the heart looked normal size, actually has cardiomegaly. So you don't always have to have a big heart on an x-ray to still have a big heart inside. Well, that sounds kind of sweet, right? Anyway, so those were the three x-rays that are kind of abnormal pathology that we discussed today. I hope you enjoy this video and this series, that you find the content valuable and that you're learning through it. I'm certainly learning by making them and taking notes and getting ready to prepare this video for you guys. So if you want to see more, you have to share, you have to like, you have to comment, and I will keep motivated and try to do a video every day or every couple of days in radiograph interpretation. We'll see you in the next one. Bye-bye.